Perfect. So we're very, very privileged and lucky to have with us Dr. Rob Rutledge here today. So Dr. Rutledge is a radiation oncologist and associate professor of medicine in Halifax who treats prostate, breast, and pediatric cancers. He's the clinical lead for the PCPEP program. And over the past 27 years, Rob has dedicated himself to delivering hundreds of free public talks, webinars, and charity-led initiatives. He has organized and led 68 weekend retreats across 30 cities worldwide, as well as conducted dozens of day-long healing seminars for patients and medical professionals. And so if you have had a chance to join us for one of Dr. Rutledge's talks before, you'll know it is going to be great information that is presented. He has also done a 5-part healing and empowerment series for us in the past as well. So that's also available on our website if you want some additional support. But for today, I'm so happy to pass the mic over to you, Dr. Rutledge, and thank you so much for being here. Oh, and I think you're on mute. Oh,
Mute.
there we are.
Share
Perfect.
again. There we go. Thanks, Vanessa, for the wonderful introduction. And welcome everybody within the Wellspring community. You folks can make a tremendous difference in your health and happiness through this issue of empowerment. And Wellspring's programs are a key component of that. I see it as a kind of a marriage between getting the best care from the medical system and then everything else you can do to empower yourself, body, mind, and spirit. And so it's that combination of the two. It's an integrative approach that really gives you the best chance of recovery and to be healthier and happier. This topic, navigating anxiety and fear of recurrence, is one of the most difficult ones to address. And there's some paradoxes here around it. You're not going to get back to perfect. You're not going to get back to like totally zen, perfectly happy all the time. That's not the goal. In some sense, the goal is to be able to know that this is normal, that you can work with it, and that you can be more resilient psychologically as these normal emotions come up. So I'm really excited to empower you, not with just information, but we're actually going to learn some really key skills today. So point number one, anxiety is to be expected. You're going to feel anxious. You're going to experience some fear of recurrence, almost certainly. But you can use that same life force focus to empower yourself to get the best care from the medical system, and then ultimately to take care of yourself more. And so you'll be more resilient and ultimately happier. So one of the key points is I'm really hoping that you can walk away with is this idea that you figure out what you need to do. Like you're very concise around getting the best care from the medical system. You know how to empower yourself. You recognize when you're feeling anxious and what you need to do. And then you let go, right? Because you can't control everything. And so you focus your energy, things you can control, feel good about that, and then let go of the rest and live your life fully at that point. The truth from a scientific perspective, if you're kinder to yourself, if you're wise with yourself, you're compassionate with yourself, you're actually more likely to make a psychological change. And compassion is just not a kind of a sense of being really easy or lenient on yourself. There's some sense of discipline in doing the work, et cetera, et cetera. But compassion, a caring, seeing yourself as a person and being, really kind to that person. And ultimately, this is an empowerment talk. You can make a difference in your life. I'll tell you the one story. So I often listen to YouTube videos before I give the talk. And one bit of the science is there's not necessarily a correlation between a person's risk of having their cancer come back or progress and how much fear of the recurrence they may be experienced. So there are some people who have a very, very, very high chance of being cured of their cancer and yet have a very high fear of recurrence. There are other people whose chance of cancer coming back is higher, even much higher, and yet they seem to be at relative peace. And so when I hear that, I think, well, it's more than just genetic. It's actually psychological. And at the level of the psyche, that's malleable. You can actually train yourself to be happier, to be more clear thinking, to be the best version of yourself more often, right? So this is This is about actually changing your perception of the world so you function better, have more energy, your immune functions better, and you have less fear of recurrence as you're doing that. So, how are we going to get there? So, this is the content of the talk right now. I want to have you think about the fact that you're human. You've got this brain between your ears. You've been wired for anxiety through the millennium, through evolution. So how do we work with that? And part of it is setting your intention. If you're so darn busy loving other people and doing what's most meaningful to you and manifesting your values, it's harder to experience fear, or the fears come less often, is maybe the other way to think about it. Another thing I think about is, can you set up the conditions in which you are less likely to be primed into those sudden flares of anxiety and fear, right? It's like, can you give yourself a resilient brain, a resilient psyche? And the answer is yes. So you're setting up the conditions of calm, setting up conditions in which you return back home to that more peaceful, clear thinking, loving person, that best version of yourself. So I want to think about that. And what you do, having a plan when the flares are going to happen, what you do in those moments. And talk a little bit about the psychological issues of reframing the difficult thoughts and the acceptance and commitment training, which again is a psychological perspective that is very wise, right? Because this is ultimately about you living your life with more peace, more harmony, just being in that kind of a state of groundedness, coming back home to yourself. And so, how can we train ourselves towards doing that? And it's partly, and the other thing I want to say to you, just as we go forward, this presentation, it's super helpful for you to listen to this and just experience, because you are going to feel some anxiety, some fear as I'm talking about these issues. And this is actually good for you to kind of what I call minimal exposure. You're getting used to the unknown, and as you get more and more used to the unknown, then you can recognize that you have a lot more power over it than you expect. So it's a desensitization presentation. You're not making your chance of recurrence worse or progression worse by talking about fear of recurrence. In fact, you're getting stronger, you're getting more resilient by listening and staying with the uncomfortable feelings and not running away. Okay. I always put this within the context of what I talked about was the marriage, is the empowerment piece, understanding, and then practicing the skills, getting the best care from the medical system. And the fear of recurrence part of this, the medical system actually plays a role to kind of reassure you as to what you need to look for, what not. And so you won't be super stressed every time you get a cold, for instance. There's the empowerment piece. When we physically take care of our bodies, the level of the exercise, diet, et cetera, we become more resilient. It changes our brain function, healing at the level of the mind, the psyche. There's neurocircuitry there that can be changed, and then nurturing a spiritual perspective. We humans go through this process, called a cancer diagnosis. How can we learn from it? How can we grow from it? How can we find meaning? How can we give back? How can we let our love out in the midst of that journey? It's really the kind of a spiritual perspective. I think this is really important, even going into a lecture, going into a medical appointment, going into a difficult situation, maybe, having a difficult conversation with a family member, your presentation at work. Like, there's lots of kind of stressful situations that we know we're going to go into, right? And it's normal. It's normal to feel anxious when we don't know what the outcome is. So that's just, we are wired that way. However, we can influence how we're going to be to a certain degree in that circumstance, how we're going to act, how we're going to perceive the world. And so I think it's really important to deliberately set your intention for how you want to act going into that. So it's in preparation, thinking about this. I mean, it could be in preparation of your day, preparation of going out with your friend for a tea or whatever. What do you hope for yourself? How do you want to be? What are your greatest values? How can you manifest that? There, put your energy there. It's so important that you see a higher picture, something that's bigger than yourself, that will allow you to get beyond just getting so fixated as what's going to happen to me, kind of that kind of self-absorbed picture. Because when you see that, how is it that I can let my love out into the world? It just, no matter what happens externally, you still have the power internally to how you're going to interact with that next person. So, as a ritual, I like to do that first thing in the morning so I can remember I want to be helpful, I want to be compassionate, I want to be kind, I want to make good decisions. So I'm trying to think about how to be my best self going into the difficult situation. So into the medical appointment, I want to be clearer thinking. I want to advocate for myself. I want to make sure that my questions are answered. You're like thinking about what is the purpose, and you're going to do that way. And what's most difficult then is the middle of the chaos. So if you've lost it, you're anxious. How do you come back? How do you come back to center? How do you come back to yourself? Right. So it's like do that by setting your intention at the start of the day. So why don't we just do that as a shorter exercise right now? Um, I'll just do a little bit of mindfulness, a little bit of breathing, a little bit of visualization. Then I'm going to ask you to remember what you value most and remember a situation in which you manifested or what you want more of. For instance, if you want more peace, calm, clear thinking, I want you to kind of remember a situation in which you were like that. So that's going to be the exercise. You can follow along as you want to. There's no right or wrong to this. I like to come off the back of my chair. Whew. In fact, why don't we sigh? Like one big sigh. Yeah, and one more. Just let the sigh out. Very nice. Come back into your body, the physicality of your body. Nice, strong posture. Looking forward, looking down, eyes closed if you want to. Bring your attention to your feet, sense of connected with the earth, pragmatic earth. Bring your attention to your hands with a sense of curiosity. Bring your attention to the sitting bones, kind of connected with the chair. And your backbone now, that strong, grounded backbone. You're grounded to the earth through your physicality. Bring your attention to the front of your chest, middle of the chest, the area of the heart center. And allow that to open, sense of warmth, sense of softness, vulnerability. It's good. We're both strong-spined and warm-hearted. Bring your attention to your breath now. Very curious. Try to allow yourself to sink into a sense of relaxation. Nice, long, slow, smooth out breath. Okay, so this is part of the relaxation technique. Really slow down the out breath. Very long, slow, smooth. Breathing in deeper, but a nice, slow, smooth out breath. You're rewiring your brain. You're settling down your nervous system. And again, slightly deeper breath in. Nice, long, slow, smooth out breath. Now bring to mind a time when you were in a state of mind that you want to be in more often. So maybe a sense of peace, a sense of calm, a sense of joy, a sense of centeredness. And just remember what was happening. Remember what that felt like. In fact, you can experience those same sensations in your body right now. What you were hearing, what you're feeling on your skin, what you're feeling in your heart. How did that make your body feel? And allow yourself to experience that now. Now imagine that you're absorbing that feeling into your psyche. You're absorbing that feeling into your heart, to kind of the emotional system. And it's getting imprinted there so that you can get there more easily, more often. Good. And you can let go of that and kind of come back to the sense of the lecture, sense of listening to the talk now. So what I took you through is something called taking in the good, a technique that I learned from Rick Hanson of the Buddha's Brain and Hardwiring Happiness. It's the idea that when you're in those positive emotional states of mind, either practicing, visualizing, or actually in the day to day, you're out for a walk and going, wow, this is really cool. I love that crisp air. I love that sunlight. Love that feeling of walking and breathing in the air. Right. So instead of just like passing that by, okay, well, I experienced that, you actually stay with it. Sense of gratitude, sense of peace, sense of joy. And you hold on to that feeling for at least 15 seconds, 15, 20 seconds. Even now, you can have a sense of joy, sense of gratitude. Oh, okay, that feels good to remember that. So whenever possible, take in the good, hold it for 15 seconds. There's that kind of little tweak of letting it absorb into your brain or your psyche or your heart or your emotional system. But that I think that simply prolongs the feeling. And so you're training your nervous system to be in those states more often. You're balancing that off against the negativity bias, which means any little thing that could be perceived as negative gets a lot of attention. You think about it for a long time, type thing. So you want to balance it off by taking in the good, right? So this is about rewiring your nervous system. This kind of entire lecture. And you do change, like your neurocircuitry changes if you practice being agitated, flustered, stressed, overwhelmed, anxious, worrying. You get good at that. You get better and better and better and better at that. If you practice being calmer, more loving, clearer thinking, more centered, practice that on the day to day, you get better and better and better at that. And so the wiring happens one way or the other, and the pruning of the system towards what you're not practicing starts to go away. Okay, anxiety. So a diagnosis, it makes sense, right? It's often unexpected decision making, sense of self, elements of grief, right? And so I'd say allow yourself to grieve too. I mean, you're going to go through difficult things like loss of a friendship. Your some friends will withdraw, and they weren't really true friends in some sense, and so you can grieve that. Oh, that's disappointing, and the grief can dissipate over time, but it's not worth kind of holding on to it. The grief has its perspective, and then you let go of the thoughts that aren't empowering you. I call it the end of treatment meltdown, right? So finish your chemo, your radiation, or you finish your kind of cancer treatment, you're told to go home, and then people around you are like, oh, you should be back to normal, but you're not the same person, right? And so it's difficult to reintegrate. And again, it's normal, it's expected. Whenever there's a transition, where there's unknown, the anxiety feelings come up. It's normal. We can just look at them as feelings. We don't have to um, tap into them, reinforce them. It's like, now those are the feelings that I'm happening, and you're still trying to psychologically process, how is it that I can be in the world now with this new situation? And we humans are just wired. Any sense of unknown, any sense of not knowing what's going to happen, the kind of fear process is going to kind of produce a kind of generalized anxiety. Normal. And we don't have to judge ourselves for feeling those anxious feelings. That's the starting point. The starting point is to be completely open and objective about what you're feeling, what you're going through, and not trying to fake in some sense. Like the starting point is to say, okay, this is how I'm feeling right now. In fact, as a corollary, right now, whatever you're feeling is okay. That's your starting point. Then we can work with it. And it's the paradox of acceptance. I accept that I'm here, and proactivity, which is I can work towards being in a better state of mind and yet not grasping at an outcome. Okay, so fear of cancer recurrence, fear, worry, concern related to the either coming back, or if you have a cancer, if the cancer progressing, expected. It's a range, right from, these tiny flares concerns, like people totally comfortable, to severe debilitating anxiety, right? And again, we're being realistic about what we're going through. It can happen. Now, I think of it as kind of flares. If you're doing well, the flares probably happen less often. However, you're still getting these kind of flares of anxiety. Um, and then it's just not it's just not anxiety. It's actually the thoughts can become more pervasive. The emotions are there, and it also can affect our how we interact in the world. And again, it's that kind of clear thinking, like, well, how is this really influencing me? What is really happening in my life? Both thoughts, emotions, and actions. And so then also anxiety, that feeling like something's wrong, a sense of fear, a sense of kind of dread, can go right from, it not being an issue, it motivating you to take care of yourself, exercise and take care of your diet and practice relaxation and all the good stuff that you can do. Taking, getting to bed at a good hour and practicing that stuff, not agitating yourself unnecessarily. I like this little quote. It's like a whale that moves into your living room. Over time, the whale gets smaller, but never quite goes away completely. A tenant you can't get rid of. Maybe it gets down to the size of a magazine rack. Once in a while, you bump into it, and sometimes it swells up in your face again, like when you go for scans. So I really like this kind of image because it's real. It's like we humans are going to hold on to that little whale on the magazine rack. It's not going to go away. Another analogy was like it's in the back room of the house type thing. So it's not like it's never going to be there. That's the purpose. It has its place in some sense to keep you motivated to take care of yourself. But the whale is going to get smaller and bigger, and hopefully stays smaller the vast, vast majority of the time. And it can flare at certain times, for instance, when you're coming up to a scan. And so there's a whole kind of complex that goes along with what they call FCR, fear of cancer recurrence. Right from kind of, I'm looking up top here, death related thoughts, like, like the cancer's going to come back and I'm going to die. So those thoughts are kind of coming in and bothering you. It definitely, a lot of people do feel alone, even if they're supported by loved ones in the wonderful wellspring community. Oftentimes people do feel alone and disconnected. So I kind of unjustified belief. I know the cancer is going to come back, or uncertainty is the anxiety, um, imagery that it's difficult to control. And it's a persistence. It's an intrusive. It's causing you not to kind of enjoy your life or to function on the day to day. It can increase over time, distress, impacts on the daily life. So again, spectrum, right? You're going to have some times where this is not an issue at all, other times where it's kind of holding you down a little bit, holding you back. How common is it? Vary is really the takeaway. So at diagnosis, about 75% of people are kind of dealing with that. Probably in the long term, it averages about 50% people continue to hold on to it. 70% if you're in a vulnerable population. I'll talk about that mostly. And then really what I really want you to think about is, really, is it disabling you? Do you need professional help to actually get through that, figure out how to work with this in a practical day to day so that you can function better, enjoy your life more? And so I would really recommend the professionals if it's disabling. It's number one. It really is. I think this us humans do that. So, and then also the anxiety and depression. So 1 in 3 suffers like what would they call clinical depression or anxiety at some point in their cancer journey. All to normalize this for you. This happens to us humans when we get a cancer diagnosis. It's okay. We don't have to feel ashamed about it. We can work with this. This is the starting place. So then risk factors, you're thinking about it. So if you think, you're a higher chance of having your cancer come back, if you typically you haven't felt like, I can cope with things like one thing at a time, I can do this. If you don't have that capacity, then definitely you're at a higher risk of fear of recurrence and anxiety. If you need to be reassured by multiple calls to the doctor, et cetera, et cetera. We don't know. I mean, the males probably underreport the situation. Definitely younger people do. If you're suffering some physical symptoms or your quality of life has been affected by your cancer, then you're more likely to suffer fear of recurrence. If you don't have the background, like if you like Wellsprings, usually you guys like take care of yourselves, right? You kind of understand. So just by doing that, you're less likely to have this as a kind of ongoing basis, because really you start to understand, and then the empowerment piece comes in, and you can just kind of settle this. There are ways to settle more. I'm not promising perfection. I'm just saying settling more. And then it's kind of from a social perspective. If you don't have a team, somebody you can just chat with and say, look, I don't want you to give me advice. I mean, I'm having a really tough day. I just want you to tell you about how I'm feeling, and just let me vent. Right. So that's a mature way to kind of set up the conversation for that conversation there. So think about it as well. When does it flare for you? When does it flare? Different. So sometimes it's like just the thought by itself. Oh, I've got a cancer diagnosis, or darn, I got to do this treatment, or something that's happening can kind of tweak you into it. Um, Side effects of treatment or unexplained symptoms make sense as well, right? You get a new pain and you go, oh my God, it must be cancer. So it's like the unknowns, unexplained, anniversaries of the diagnosis, maybe the start of treatment, the end of treatment. Every year can be a tweak around that. Most everybody normally experiences anxiety coming into a cancer center appointment or screening test, et cetera, et cetera. It's really unusual for people not to feel anxious around that. And then if you find out, maybe you hear through the grapevine, somebody's got a cancer diagnosis, or a famous person is getting diagnosed with your type of cancer or dying for your type of cancer, again, that can flip the switch. Normal, expected, right? To be able just to see it. It's like, I want you to develop a kind of observer consciousness, which is you're like the angel looking at this human being, and this human being is having thoughts and emotions and reactions and so on. The angel perspective, or the observer perspective, is it's very peaceful, very clear thinking. It's your consciousness being able to watch what's actually happening, right? So you can watch, oh, there's my anxiety. Oh, hello, anxiety. I'm seeing that you're flaring again. Of course, you're going to be flaring again. This is natural. I just heard somebody got a cancer diagnosis, right? So I want you to start to relate more to the observer consciousness as who you actually are, as opposed to your thoughts and feelings and identity and the ego part of it. You're kind of in that perspective, which is a much more peaceful, much more clear seeing perspective. What's your pattern of scanxiety, either the anxiety that leads up to a scan or an appointment, right? How many weeks beforehand do you start to go, I'm worried about this, right? And then when does it peak? Usually a week coming in, definitely the night before. A lot of people aren't sleeping as well. Now you can train yourself to be more calm, um, and then hopefully you get good results, and they can watch your anxiety drop off. And usually takes maybe even a week for kind of most people kind of settle, until if it's a 3 month scan or a 6 month scan or something, then they do the same flare just prior to the same settling afterwards. So that's the pattern, right. um, and then, are you the type of person that holds on to it longer, or takes longer to let it go? Again, observer consciousness, watching, okay, that's where I'm at. How can I work with this step at a time? Okay. The great thing is, through some amazing programs at Wellspring and lots of other places, you can actually teach yourself to settle down your anxiety. Now, again, I'm not saying you're going to be anxiety free. It's just that you can have an influence on that level. So the techniques, and it's all the same stuff I'm going to talk about today, including looking how your thoughts can provoke those reactions. Mindfulness. Even right now, I want you to be curious. Just in this moment, I want you to be curious. What are you feeling? What are the physical sensations in your body? I'm actually, my gut's a little bit sore. I chomped down my lunch a little too quickly, but what are you feeling emotionally? How's your energy level? just have like a quick little check-in, mindfulness-based techniques. Acceptance and commitment therapy, again, there's these science around these ideas that you can work with your thoughts, work with your psyche, and take care of yourself and feel better. Okay. And then the last thing, I'm going to do this a little bit. We're going to actually have that suggestion of actually writing down your fears and worst case scenarios and what you would do. It's actually a very powerful technique by itself, and maybe probably done within a group scenario with other people might be the best way for you. However, I also trying to desensitize you. It's okay. Thinking about it is not going to cause a problem. Okay, I'm also, this is the pragmatic part, is just clear thinking, seeing the truth and working with the truth as the starting point. So you ask your doctor, what's my chances that my cancer will come back? So you're in the potentially curable situation. What are my chances? Because you might be like sitting at 95%, and then you really should be relaxing around these issues. Or if you have, for instance, a cancer that we think of as incurable at this time, what's the chance that the current therapy is going to work for what period of time? Right. So you're looking at it very pragmatically. It's like, just see it, accept the truth. Well, doctors don't know, but anyways, accept the truth of whatever you're happening. Um, when is that time frame? How would it come back? This is an important one. So, um, maybe breast cancer diagnosis. You could have like a rash or lumps in the skin or the breast area. You could have a lump in your armpit. You could have some pain in your bone. You could have some fatigue. Um, but it's very, very unlikely you'd have diarrhea. Very, very unlikely you'd have flu-like symptoms, right? And so you you start to understand the disease from that perspective, so that when you get the flu or a cold, you don't worry about it, because that's not how that cancer comes back. Is there anything I can do to reduce the risk, which we're going to talk about anyways? It's like one integrated package. And again, I want you to feel like you're doing everything you can. Like, I've covered the bases. I don't have to be anxious about missing something else, taking the shark cartilage, for instance. I'm just like, no, I've done everything. It's in God's hands now. I'm just going to live my life fully in the interim. Whether I got 2 years to go or another 52 years to go, why don't I just live my life fully in the meantime? Okay, so understanding the signs of recurrence. So you stop worrying about symptoms, the flu and diarrhea, arthritic type pains. Like, arthritic pains kind of cup up and down. It has a certain pattern, right? So you don't have to just get some pain in your bone. It could still be arthritis. The melanoma example, pain is constant, severe, progressive, growing lump on the skin, debilitating fatigue, right? So lots of nuances that you would want to get from your healthcare team there. Okay. Next is the hand model of the brain. So through evolution, it's like building a house. Hopefully you can see this. The wrist is like the spinal cord. The base of the thumb is the reptilian brain, the first part of the nervous system that was growing, which was essentially withdrawing from danger. The next one up is the limbic system, which is the reward-seeking system. I also call it the stress pathway. And then over top of that is the frontal lobe. And this is the good part. You want to live your life running on this one fully. And what happens is we get ourselves stressed or frustrated or in fear, anxiety mode, and we flip our lid. We detach from our frontal lobe, that part of us that thinks clearly, is compassion, is the best version of yourself. And then if you can, you bring yourself back home again. You start to center, you gain your calm, et cetera, et cetera. And all day long, back and forth we go. And so what I'm trying to point towards is being here, living out of your frontal lobe more often, less likely to flip, and more easily getting back into it, recognizing this and coming back home to, the better version of you, the happier version of you. So wise and compassionate, right? As opposed to the irritable stress brain that can't think and is just so threat irritable and moody. And, it's just not good for your immune system to stay there for too long either. So the question is, how can you stay there more often? And I think about it setting up the conditions, the resilience, growing your brain, getting stronger. And so creating conditions for calm, which actually changes your brain as well. It's motherhood stuff, but it's just the truth. Exercise. And if you don't like that word, physical activity, movement, dance in your kitchen, listening to a YouTube music from your childhood, do something that's fun. But it really is very important. It's anti-anxiety. As soon as you move your muscles, you release chemicals from your muscles called myokines that immediately go up to your brain to make you feel less anxious. So 3 minutes is the feel better effect. 20 minutes is the persistence high that can keep on going. I also say get up 5 minutes on the hour. So sitting too long is also not healthy. Can we just stand up for a second over here? Even if you're listening to the video, just do a little stretch, just so that you can remind you that moving, looking up, looking away from the computer, however it is for you, do something just to kind of stretch yourself up. Okay. Diet, when we eat sugary stuff, it's not good for our brain in lots of different ways. So you want to have your blood sugar levels kind of moderated. So have some proteins there. The omega-3s are important for your brain health. Time restricted eating, meaning you don't eat for, 12, 14, 16 hours overnight, all has an influence on brain function and anxiety levels. Getting a better night's sleep, which again has this whole kind of perspective as how you can manifest that. It's like training yourself to be more sleeping. Practicing relaxation technique is actually key. You're actually innervating your frontal lobe when you're practicing relaxation. Doing the things that nourish your soul, like life is short. Like do something that feels good. Touch, social connection. We're so wired from an evolutionary perspective to be with people, think of people, or your cat or your dog. It's that kind of sense of connection, the oxytocin you get from that. So we create the conditions for calm, in which we're more resilient. Our brain actually grows. The frontal lobe, left frontal lobe gets stronger by doing these things. We're avoiding, it's probably not necessary to watch television news or horror show before you go to bed, or unnecessarily upsetting activities, or scrolling through social media. It's not good for your brain. There's an epidemic of anxiety right now. Let's try to be kind. Be kind to yourself by not priming and bothering your brain. So mindfulness, we talked about this ability, that the observer consciousness, again, to be able to watch when you get yourself ramped up. And so I'll take you through this exercise of when do you kind of lose it? Whoa, thinking about that last really stressful situation, what happened physically to you, right? The pounding heart, the change in breathing, the change in muscles, achy, jittery, sweating palms. What happened to you emotionally? Again, that could be the cue. Oh, I'm suddenly really irritable, or I'm really feeling scared. I feel like I'm going to cry. Could be the cue to say, okay, I've wound myself up. How your thinking changes, not the content, but the how. I can't think clearly, or you get fixated or running that loop, fast manic, could be the cue. What you think, right? Pointing the finger at others or yourself or at life, swearing, labeling other people. These are all cues to say, I lost it. So then what do you do when anxiety flares? Right? So you're like, I'm frustrated, I'm stressed, I'm scared. Have a plan. Know what technique works for you, because you're going to kind of practice. You have lots of opportunities like the rest of us, right? First thing I like is this kind of mindfulness. Again, observer consciousness, watch. Okay, this is interesting, right? This character here, the observer consciousness, has a different perspective. It's like, oh, wow, that's kind of different. This is what a stress reaction looks like for you, right? So it's like it's non-judgmental and curious. Typically, you can talk yourself down. This is not worth worrying about. I've got myself wound up. Why don't I, just settle down now? Mostly it's hard to do. So you can practice a breathing technique. You can slump. You can even slump right now. Slump, maybe even like pretend you're chewing gum. It's hard for your body and your mind to be anxious when you're in a slumped state. Um, Remember what it's like to feel good. I think that one's good for like if you're giving a presentation. The presentation is going to be over, and then at 5 o'clock tonight, I'm going to be having supper with my spouse, and we're going to be enjoying ourselves then. Talk to someone who's listened. So okay, so I want you to take you through this one, and I'll give you a slight different version. So first of all, you see yourself like agitated, anxious, scared. Press the pause button, right? Because usually you don't have to react in exactly that moment. You press the pause button. You go into observer consciousness. You're watching that calm, watching perspective. As soon as you do that, you're actually changing where your brain is working. So then you're curious. Observer consciousness is watching what's happening physically within my body right now. As I'm doing this, I want you guys to do this with me. What's happening? What are you feeling within your body right now? And then 4 slow breaths. Let's just try this one. Breathing in for a count of 3, hold for a count of 4, and breathe out for a count of 7. Breathe in for a count of 3, hold for a count of 4, breathe out for a count of 7. So I could do that for a couple more iterations. So 4 iterations in total, or 4 breaths in total. In the morning and the evening, that by itself can actually help you. So you're actually settling down. By doing that long, slow, smooth out breath, you're settling down your nervous system. You're tapping into the wise and compassionate part of your brain. And then you can talk to yourself. I can take this like one step at a time. I don't have to get myself wound up, et cetera, et cetera. We want to practice that relaxation technique, the 4 slow breaths, so that when you run into that situation, you do settle yourself down more often. You have that wellspring, good word, wellspring of relaxation to kind of tap into. Okay, I'll share a couple more things before we wrap up. This is an excellent book, excellent technique around unwinding our anxiety. And Judd Brewer is an addictions researcher. He recognized that worrying was an addiction. Worrying was the behavior to the anxiety, and it creates a habit loop. Essentially, the stressful thought comes up: my kid's not going to come home, from the movies or something like that. And so then you distract yourself by worrying or distraction and, going onto the internet type thing. So there's the anxiety response. So stressful thought, anxiety response, and then you can avoid it, or stressful thought and you worry. So the last point there is the worrying as a habit. Worrying what might happen gives you some sense of control. If I worry about it, then therefore I'm doing something to help myself. And it's just kind of like a false sense of control. But the worrying by itself makes you feel worse. You're catastrophizing and you're creating a vicious loop. So worrying can be a kind of habit that's not a good habit to have. Watching our anxiety. So willpower doesn't work. Like I'm just going to force myself into just being positive all the time. It starts with mindfulness, what I've been talking about, the observer consciousness. Watch yourself very carefully through each of the stories there. And then you map out, when is it that this is the trigger? How do I think about it? What is my resulting behavior? Do I overeat, for instance? Do I worry? And ultimately, you want to replace the poor behavior with more curiosity. It's like, oh, okay, this is interesting. I'm worrying. This is okay. So then I'm just going to watch myself. And then the brain gets really good at kind of being curious around that. Okay. So working with thoughts. It's unlikely this is cancer, right? So just like this is very pragmatic. I was screened X months ago. Things were fine. If I still have this a few weeks from now, I'll talk to my doctor if need be. There are millions of cancer survivors. Why shouldn't I be one of them, right? So this is just like pragmatic stuff that says, okay, let's just put this as a purely rational perspective, right? Situation, medical checkup. I'm anxious at the start. Automatic thought, I can't do this. I'm not strong enough. What is the evidence? Well, actually, it's contradictory evidence. I've been able to cope with lots of things before. It might be difficult, but I can take this one step at a time as the kind of reframe. And if you do that kind of reframing, then oftentimes you feel less anxious by simply looking at this is a cognitive reframing example. And I'm not going to take you through all the kind of cognitive reframing. So I'm just going to flash my way through this, and maybe just an example. I'll just take you to the example because it becomes pretty obvious. So you're thinking about this next appointment. You're going into the next appointment. I can't handle this. This is too much. This is never going to work out. My life is totally out of control, right? So you can see how in that moment you're catastrophizing, or the person who's thinking this is catastrophizing, and that catastrophizing is actually going to make them feel worse, make them feel more anxious. So we look to deconstruct that in some way. We reframe it. So start out with, how do I feel if I think this way? Well, I feel anxious. This is upsetting. It gives me a stress reaction within my body. It's not helpful for me to think this way. And it is exaggerated because, quotes, I can't handle this. Well, actually, you are handling. This is too much. Well, it is a lot, but it's not too much. This is never going to work out. How do you know it's never going to work out? You could do perfectly well. Life is totally out of control. Well, there's elements of life that we can't control, but it's not like totally out of control, right? So you're kind of talking to yourself like a lawyer would. And then the kind and rational response, we acknowledge ourselves. We look at a situation in a different way. And then we're also encouraging ourselves. So the reframe could be something like, oh, yeah, this is tough, but it's no use kind of getting myself all worked up. I can take this one step at a time, and I can find the good in each moment. I can find out how I'm going to, deal with the circumstance in a way that's best for me. So it's like, it's both kind, but also like encouraging. There's lots of other ones that I can go through. So, and I think I'm just going to skip through the emotional stuff and just maybe finish with this idea of uh, suggesting that you have the the way to kind of look at the fear more directly. And so, and this is usually done within a support group scenario. And I've heard lots of things like, what scares you most? What is it about death that scares you? It's the suffering before death. Is it the afterlife? Is it the loss of control or dependence, being a burden, not being there for your family suffering? So there's lots of things that can upset us around that. But if we can have that conversation, think about it, you would recognize that you're stronger than you think. You really can cope. And I've seen those same scenarios. I see my patient now, I see my patient in 5 years' time, and they're in a difficult situation. They have a lot of resilience. People have more resilience than they expect. Oftentimes we judge ourselves for suffering these difficult emotions. And I'd ask you, what's your relationship towards your anxiety? Do you see that as toxic or stressful and need to be managed? My life is toxic. This is too much. Or do you say anxiety is like part of life? My anxiety means something important is at stake, and here's a good opportunity to learn. And I'll leave you with this idea. The last idea I want you to realize is we don't have to tap into every thought. If we get kind of caught up in our thoughts, imagine everything is around you is important to your life, but your hands or your thought is kind of covering up that, and you're covering up your whole life with those thoughts that are really detaching you from what's most important and what you need to get done, et cetera, et cetera. And so you're only getting a slight perspective. Why not just put your hands on your lap, be able to see what's happening, and then your thoughts are still there. You can still tap into the wisdom of the thoughts, but it's easier to see what's happening and easier to make a good decision and to feel better in the circumstance. Okay, I think that's it. Remember the occasions where you successfully manage uncertainty, right? We've had a whole life experience of, because we're going to not do perfectly all the time. I'm doing the best that I can, and we aim for neither too much anxiety or like no anxiety. It's just like it's okay. This is the normal natural process. Last slide. There's a program, 6-month program that we've set up. It's daily emails and videos by myself and a psychology professor. Very, very comprehensive, right? So we're teaching exercise strengthening. We're actually working with fear of recurrence, stress reactions, relationships. It's a total program, monthly video conferences right now. It's actually at cancerpep.com, which is the website right now. But you can get to through cancerpep.org. I'd highly encourage you folks to join us. I think that's it. There's our website and Cancer Pep. Thank you so much to Wellspring for inviting me. I'm looking forward to a little bit of Q&A from the troops.